For 15 days, Russian researchers monitored 5 people who were forcefully kept awake by an experimental gas-based stimulant. The patients were contained in a chamber with books, cots and dried food. The 5 test subjects were political prisoners believed to be enemies of the state during World War II. Everything was running fine for the first 5 days. No one complained considering they had been promised freedom if they submitted to the testing and did not sleep for 30 days. Throughout the duration of the experiment, the subjects' conversations were closely observed. After 4 days, the general conversation started to develop ominous mannerisms, and the conversations were commonly based on traumatic experiences. 5 days have passed. The patients started displaying signs of extreme paranoia, complaining about circumstances and events that had led them to where they are now. Each patient had now stopped social interaction with one another and instead started softly whispering into the microphones. Day 9 and onward. One test subject had begun screaming and running the length of the chamber. This screaming had proceeded for 3 hours until he was barely able to make a noise. He had physically torn his vocal cords. Not one test subject reacted to this irrational behaviour. 3 days after this, the oxygen levels of the room displayed that the patients were still alive, but not one sound could be heard. In fact, the oxygen levels shown that the patients were at a level of strenuous exercise. On the 14th day, the researchers used the intercom to announce that they are opening up the chambers to check the microphones. If they did not lie down, they would be shot, and in compliance to these orders, will grant one test subject their freedom. A voice softly replied, "We do not want freedom." The researchers decided that midnight of the 15th day, they were opening the doors to the chamber. As soon as the doors were opened, the room was flushed with fresh air and fumigated of the experimental gas. Instantly, voices from the microphone began to object and begging for the doors to be closed and the gas to be turned back on. Soldiers were sent into the chamber to retrieve the patients. As the soldiers entered, the subjects screamed louder than ever before, as did the soldiers. 4 out of 5 test subjects were alive. The food rations for the past 5 days were untouched. The drain in the centre of the chamber had chunks of thigh flesh from the dead test subject clogging it. The remaining subjects had bits of flesh and muscle torn off themselves. The destruction of flesh and exposed finger bone on their fingertips indicated that wounds were inflicted by hands and not by teeth. Closer examination concluded that most of the inflictions were self-inflicted. The abdominal organs below the rib cage had been removed for all test subjects. The digestive system of the subjects were able to be seen. It was clear that they were digesting flesh that they had eaten over the course of the past few days. When the patients were being removed from the chamber, they fought. One soldier died from having his throat ripped out. During the struggle, one subject had his spleen ruptured and died almost immediately. Being sedated with 10 times the recommended dose of morphine, he was still fighting, resulting in breaking one of the doctor's arms. The remaining test subjects were transferred to a medical facility. The most injured patient was taken to a surgical operating room. He was immune to the sedative that was given and fiercely fought against his restraints. After enough anesthetic, the patient fell asleep. During the autopsy of the subject, it was found that his blood levels contained 3 times the usual amount of oxygen. His muscles were greatly torn and he had 9 broken bones. The second patient was the first to begin screaming out the 5. Due to his vocal cords being destroyed, he was unable to beg or object to being brought to the surgery. This subject underwent the surgery without any anesthetics and did not react for the whole 6-hour procedure of having his organs replaced. One terrified nurse stated that the patient's mouth curled into a smile whenever his eyes met his. When the operation was done, the patient began wheezing, trying to speak. The doctor fetched him a pen and a notepad, and what was written was simple: "Keep cutting." Though the 2 subjects were given the same exact surgery, however paralysed, due to the surgeon not being able to perform the operation while they manically laugh. Researchers questioned the patients, asking them why they harmed themselves, why they had ripped out their own insides, and why they begged for the gas. Only one response was given: "We must stay awake." All 3 subjects were planned to be sent back to the chamber with the gas turned on. In preparation for this, the patients were connected to an EEG monitor and were heavily restrained. As soon as the word slipped that the gas was going to be turned on, all 3 patients stopped struggling. The subject who was able to speak was humming loudly. The mute subject was straining his legs against the leather bonds. The remaining subject was holding his head off his pillow and was blinking rapidly. The EEG reported that the patients were normal most of the times, but occasionally flatlined. It seemed as if they were repeatedly suffering from brain damage. The only remaining subject who was able to speak started screaming to be concealed inside the chamber now. The commander gave the order to seal the chamber, locking the 2 alive patients and 3 researchers. One of the claimed researchers pulled out his gun, shot the commander and the mute subject. He then pointed his gun at the remaining subject and questioned him on what he was. The subject smiled. The subject asked, "Have you forgotten so easily? We are you. We are the madness that lurks within you all, begging to be free every moment in your deepest animal mind. We are what you hide from in your beds every night. We are what you sedate into silence and powerless when you go to the nocturnal haven we cannot tread." The researcher shot the subject directly in the heart. As the EEG flatlined, proving his death, the subject choked out his last words. "So nearly free."